Your head weighs about 10 to 12 pounds, but when it drifts forward, even by just 2 inches, your neck has to support the equivalent of 32 pounds. 3 inches forward? That's 42 pounds of constant pressure crushing down on your cervical spine every single moment of every single day. And after 60, most people's heads are sitting 2 to 4 inches forward without them even realizing it. This forward head posture doesn't just look bad. It compresses the discs and nerves in your neck, causing chronic headaches, shoulder pain, arm tingling, numbness, and even dizziness. A study published in Surgical Technology International found that every inch of forward head posture increases the load on your cervical spine by approximately 10 pounds, leading to accelerated disc degeneration and nerve compression. But here's the good news. Cervical traction, the gentle decompression of your neck vertebrae, can reverse this damage. Today, I'm going to show you 5 safe, effective ways to decompress your neck at home and relieve the pain, headaches, and numbness that have been stealing your quality of life. Before we start, drop your name and where you're watching from in the comments. By the end of this video, you'll understand exactly why neck compression happens after 60 and how cervical traction works to reverse it. And you'll learn 5 simple techniques you can do at home to decompress your neck, reduce nerve pressure, and eliminate chronic headaches, shoulder pain, and arm symptoms. Most techniques require nothing more than a towel and a few minutes. Before we begin, always consult your doctor or physical therapist before starting any neck decompression routine, especially if you have severe osteoporosis, recent cervical spine surgery, or conditions that cause sharp shooting pain or significant arm weakness. Mild stretching and relief sensations are normal. Sharp electric pain or increased numbness is a stop signal. Every technique has modifications, so let's start with number 5. Towel-assisted cervical traction. And this is going to be your gentle introduction to neck decompression. This technique uses a simple bath towel to create gentle upward traction on your neck while you're lying down. It's one of the safest and most effective ways to begin decompressing your cervical spine because you control the amount of pressure completely. Research published in the Journal of Physical Therapy Science found that towel-assisted cervical traction significantly reduced neck pain, improved range of motion, and decreased headache frequency in older adults with cervical compression. Here's how to do it safely. Roll a bath towel lengthwise so it's about 3 to 4 inches thick. Lie on your back on a firm surface. Place the rolled towel at the base of your skull, right where your head meets your neck. Now, hold both ends of the towel with your hands and gently pull upward and slightly toward your chest, creating a light lifting sensation at the base of your skull. Your head should feel like it's being cradled and gently pulled away from your shoulders. Hold this gentle traction for 30 to 60 seconds while breathing deeply. Release slowly. Rest for 30 seconds. Then repeat 3 to 5 times. If you feel any sharp pain, lighten the pressure. The goal is gentle decompression, not aggressive pulling. You should feel relief, not strain. As you improve, you can gradually increase the duration to 90 seconds per hold. This technique creates space between your cervical vertebrae, allowing discs to rehydrate and nerves to decompress. It's particularly effective for headaches that originate at the base of your skull. Number 4 is all about chin tucks with resistance, and this is what I call your postural correction strengthener. Chin tucks don't just stretch your neck, they actively retrain the deep neck flexor muscles that pull your head back into proper alignment over your shoulders. When these muscles are weak, your head drifts forward and stays there. Strengthening them is essential for long-term neck decompression. A clinical trial in the Journal of Manipulative and Physiological Therapeutics showed that chin tuck exercises combined with postural training reduced forward head posture by an average of 1.2 inches and significantly decreased neck pain in seniors within 8 weeks. Here's how to perform it. Sit or stand with your back against a wall. Keep your shoulders and head touching the wall. Now, gently pull your chin straight back, like you're making a double chin, without tilting your head up or down. You should feel a stretch at the base of your skull and engagement in the front of your neck. Hold this position for 5 seconds, then relax. Do 10 repetitions, 2 to 3 times per day. For added resistance, place your fist gently under your chin and press your chin down into your fist while simultaneously pulling your head back. This adds strengthening to the decompression effect. This exercise retrains your posture from the inside out, reducing the forward head position that's been compressing your neck for years. The stronger these deep muscles become, the less your neck has to work to hold your head up. For number 3, we're moving to doorway stretch with neck extension, and this is your chest and anterior neck release. Forward head posture isn't just caused by weak neck muscles. It's also caused by tight chest muscles and shortened tissues in the front of your neck that literally pull your head forward. Releasing these tissues allows your head to move back naturally. Research from Physical Therapy Journal shows that combining chest stretches with neck extension significantly improves cervical alignment and reduces compression symptoms in patients with forward head posture. Here's how to do it. Stand in a doorway with your arms raised to shoulder height, forearms resting on the door frame. Step 1 foot forward into a gentle lunge position and lean your body forward slightly until you feel the stretch across your chest and the front of your shoulders. While holding this stretch, gently tilt your head back, looking up toward the ceiling. You should feel a stretch down the front of your neck and throat. Hold for 20 to 30 seconds, breathing deeply. Return to neutral. Rest. Then repeat 3 times. If tilting your head back causes dizziness, reduce the angle or skip the neck extension and focus only on the chest stretch. Never force your neck into pain. The stretch should feel relieving, not pinching. This technique releases the tissues pulling your head forward while creating space in the front of your neck, allowing your cervical spine to decompress naturally. Now we're at number 2. Supine neck retraction with pillow, and this is where we add gravity-assisted decompression. This technique uses your body position and a strategically placed pillow to create passive traction on your neck, while gravity helps pull your head back into alignment. It's deeply relaxing and highly effective for chronic neck tension and headaches. Here's how to set it up. Lie on your back on a firm surface. Place a small, firm pillow or rolled towel under the natural curve of your neck, not under your head. Your head should rest on the surface, tilted back slightly so your chin points gently toward the ceiling. This position allows gravity to pull your head backward, creating gentle traction. Relax completely and breathe slowly for 3 to 5 minutes. Focus on letting go of all tension in your neck, shoulders, and jaw. If this position feels uncomfortable, adjust the height of the pillow or towel. It should support your neck curve without forcing your head into an extreme backward tilt. The goal is gentle, sustained decompression, not aggressive extension. This technique is particularly effective before bed because it decompresses your neck while activating your parasympathetic nervous system, preparing your body for restorative sleep. And finally, number 1. Seated self-traction with head lift, and this is your active decompression technique. This is the most direct form of self-traction you can perform without equipment. You manually lift your head to create space between cervical vertebrae, mimicking the effect of professional traction devices, but with complete control over pressure and duration. Research published in Manual Therapy demonstrates that self-administered cervical traction effectively reduces disc pressure, alleviates nerve compression symptoms, and provides immediate pain relief in patients with cervical radiculopathy. Here's how to perform it safely. Sit in a chair with good posture, feet flat on the floor. Place both hands under your chin with your fingers interlaced, palms facing up. Now, gently lift upward with your hands as if you're trying to lift your head off your neck. Use steady, gentle pressure. Don't jerk or pull hard. You should feel a light stretching sensation through your neck as space is created between vertebrae. Hold this gentle lift for 10 to 15 seconds while breathing normally. Release slowly. Rest for 15 seconds, then repeat 5 to 8 times. An alternative hand position is to place your hands on the sides of your head, just above your ears, and gently lift upward from there. Experiment to find which position feels most comfortable and effective for you. This technique creates immediate decompression and often provides instant relief from headaches, neck stiffness, and arm tingling because it directly reduces pressure on compressed nerves. So why does cervical traction work so powerfully? Because compression is the root cause of most neck problems after 60. When vertebrae compress together, 3 things happen that create pain and dysfunction. First, the discs between vertebrae get squeezed. These discs need space and movement to stay hydrated and healthy. When they're constantly compressed, they dehydrate, thin out, and lose their shock-absorbing ability. Traction creates space that allows fluid to flow back into the discs, restoring their cushioning function. Second, nerves get pinched. Your spinal cord runs down the center of your vertebrae, and nerve roots branch off between each vertebra to control sensation and movement in your arms, shoulders, and hands. When vertebrae compress, the spaces where these nerves exit, called foramina, narrow. This pinches the nerves, causing pain, numbness, and weakness. Traction opens these spaces, relieving pressure on the nerves. Third, blood flow becomes restricted. Compressed tissues don't receive adequate blood supply, which means less oxygen and fewer nutrients reaching the muscles, ligaments, and discs. This creates chronic inflammation, stiffness, and pain. Decompression restores circulation, bringing healing resources to damaged tissues. You don't need to do all 5 techniques every day. Here's a simple routine that takes 7 to 10 minutes. Every morning, do 10 chin tucks with resistance and 1 session of doorway stretch with neck extension. This corrects your posture and releases anterior tension before your day begins. Every evening, do 3 to 5 rounds of towel-assisted traction and 3 to 5 minutes of supine neck retraction with pillow. This decompresses your neck and prepares your body for restorative sleep. 2 to 3 times per week, add seated self-traction with head lift for immediate relief when symptoms flare up. Within 2 to 4 weeks, most people notice significant reduction in headaches, less neck stiffness, improved range of motion, and decreased or eliminated arm tingling and numbness. Some people feel relief after the very first session. Your neck isn't failing because you're old. It's compressed because your head has been sitting too far forward for too long, and compression, unlike degeneration, is reversible. If you're going to start decompressing your neck today, leave a comment and tell me which technique you'll try first. And if this video helped you understand why your neck hurts and how to fix it, share it with someone dealing with chronic headaches, neck pain, or arm symptoms. Because the strongest thing about you isn't your neck, it's your commitment to creating space where compression has stolen it.